Welcome to TCM Classics. Today we are going to be doing facial rejuvenation acupuncture. And facial rejuvenation acupuncture is something that is used frequently for wrinkle therapy, all sorts of crow's feet, droopy eyelids, wrinkles on the forehead, wrinkles around the corners of the mouth, and smoker lines. And today, for those methods, like the weaving along the forehead, as well as the smoker lines, I will show you a different method with smaller needles and tweezers at a later time. Today, I'm going to be doing points on the face that I most frequently use. And I find that facial rejuvenation acupuncture brings just chi and blood to the face. You can use it between Botox treatments if you get that, as well as it just gives an overall glow, kind of makes the face look more hydrated, plump, and just more flushed and alive. And so I am here inserting DEW 24 or conception vessel 24. And it is a point that is most frequently used for epilepsy, anxiety, palpitation, insomnia, headache, dizziness, vertigo, and rhinorrhea. And its Chinese name is called Shenting or Spirit Courtyard. And the next point I'm going to be needling is called Bai Hui or 100 meeting, DEW 20. And it is indicated for headache, vertigo, tinnitus, nasal obstruction, aphasia from apoplexy, coma, mental disorders, uterine and rectal prolapse. And from a Western medicine perspective, it's indicated for headache, dizziness, shock, hypertension, insomnia, seizures, and prolapsed anus. And the next point I'm going to be needling is called Tai Yang or Supreme Yang, and it is indicated for headache. I did sneak in Tong in there before, but I did show the indications and location for that in my previous video. But Tai Yang is located in the depression about one chin posterior to the midpoint between the lateral end of the eyebrow and the outer canthus. So you just, feel both sides of the outer canthus, and it's the midpoint, one chin posterior to that. And it is a point that is used for headache, eye diseases, deviation of the eyes and mouth. And from a Western perspective, it's used for headache, migraine headache, common cold, facial paralysis, trigeminal neuralgia, and eye disease as well. And here I'm inserting stomach 3 Zhu Liao or great crevice, and it's good for facial paralysis, eyelid twitching, epistaxis, toothache, and swelling of the lips and cheek. Next is stomach 4 just below, and this is probably one of my favorite points to use. It is called Di Zang or earth granary, and it's used for mouth deviation, salivation, twitching of the eyelids, facial paralysis, trigeminal neuralgia, excessive salivation, and spasm of the eyelid. I use it for none of those reasons, except I like it for like as you age and the corners of your mouth start to go down, it sort of prevents that. And lastly, I am inserting Ren 24 here, which is called Changjiang or receiver sauce, and it is located along Ren Mai or the conception vessel. And it's indicated for facial puffiness, swelling of the gums, toothache, salivation, mental disorders, and deviation of the eyes and mouth. In Western medicine, it's good for facial paralysis, hemiplegia, toothache, ulcers in the mouth, and excessive salivation. I don't know what was up with my pronunciation, but I was trying to say salivation. I wanted to just point out as I remove my needles here that I have been doing facial rejuvenation acupuncture on and off for about 10 years or more. And I would recommend, if you do it, doing it more frequently than I do. I have taken breaks upward to a year. I'll do it like twice in a month and then not for 6 months. I'm very sporadic with it. And so I would suggest doing it more frequently than me in order to get real benefits or see results. I would say give yourself at least 10 sessions before you make up your mind about it for yourself. Obviously, I like it for me. Why I like it is it gives me an overall kind of puffy glow, flushed look, It just brings qi and blood to the areas that aren't getting it, which are wrinkle prone areas. And so it can be used between Botox treatments and filler treatments if that is something that you do, or just between Botox treatments if that's something that you do. I would consult your healthcare professional and your doctor if you're doing surgeries or Botox and filler, and like how long between, and look up, because you definitely don't want to be, needling yourself right a month after Botox. You want to give it some time. Secondly, I would like to point out that the indications, as you obviously were aware of, the indications that I was stating were also not for just wrinkles or facial rejuvenation. They were actually treating other things because they're actual acupuncture points that are used. So again, that's the cool thing about acupuncture. You're treating a couple birds with one stone, right? So as much as I'm needling my face in order to treat my wrinkles, I'm also, and tone and all that stuff, then I'm also treating all these other things kind of without trying to, in a way. So we're preventing them, because obviously I don't have a lot of those things. But say you did, for instance, have some sort of trigeminal neuralgia or something going on, these things would help as well. And stay tuned for more videos and more facial rejuvenation acupuncture to come. Have a beautiful day, and please subscribe to my channel to see my latest videos. And I am trying to get to 500 subscribers so I can be eligible to earn. You don't have to like my videos, but if you do subscribe, that would mean so much to me. And happy Chinese New Year to you.